Hello, Moraga. I'm here with your COVID-19 safety guidelines for August 2021, or at least the guidelines that we have right now. As always, we will continue to update you with the new guidelines as they come out. And as we are approaching the first day of school early next week, we wanted to make sure that all of our families and staff were familiar with the current and updated guidelines as of today. If there are any changes, I'll be sure to contact you as soon as possible. So let's get into it. First, before we begin, I want to really emphasize our objective here in Moraga. Our primary purpose is for all of our students to learn and belong every day. So, as we approach this problem of making sure that our schools are safe during a pandemic, I want to stay really focused on our why of what we're trying to do in our schools, and then talk about how we're going to achieve that so that we can keep schools open for in person instruction. So, as I just said, our why is very, very simple. We want all of our students to learn and belong every day. And a big piece of how we intend to accomplish that this year is by following our California Department of Public Health guidelines. And in the end, the result is that our students get access to full in person instruction. That's the big picture. So, a quick review on the guidance, and it is complicated. And if you're feeling like we get lots of conflicting messages, you are definitely not alone. But this flow chart shows you just a little bit of how the communication flows between the different health agencies that give direction to our schools. It all really starts with the Centers for Disease Control putting out their recommendations based on their most updated science. As those roll out, our local California Department of Public Health adapts those guidelines for our local needs and puts out their own guidelines for a variety of different places, including schools. And then finally, the Contra Costa Health Services looks deeply at those guidelines and comes up with their own local policies for how they will be implementing and providing oversight within their jurisdiction. It's all really complicated, and sometimes things don't come out at the same time. But in the end of the day, we've gotten much better at getting these guidelines out quickly and getting them in alignment with each other. At the very end of the day, when it comes to our schools, our most direct guidelines are really coming from the California Department of Public Health, which is in communication directly with our state Department of Education, and then collaborating also with our local county to make sure that we are implementing those guidelines effectively. So, as you look through the guidelines, there's really a few key takeaways for starting school. And the central focus of the COVID-19 guidance continues to be multiple measures of mitigation. I've outlined them on the screen, and I'm going to go into a little bit of detail on each of these so you know what it looks like in practice in our schools. The first piece is the daily health checks. Now, last year, you may remember that we were filling out forms on Parent Square daily and submitting those. We were doing daily health screenings to be able to track symptoms. This year, the guidance has changed slightly. We're still requiring that all families do daily health checks, really looking for any symptoms in your child before you send your child to school. But you will not need to submit a daily health screening through Parent Square. So you'll be doing these checks at home in the morning just to make sure that your child is feeling great and ready to learn, and then sending your child to school if they are healthy, and keeping your child at home if they're experiencing any of these symptoms. So, a big question coming up, will I need to submit that form? No, we will no longer require that daily screening at this time. Another question that comes up is, what if I have a symptom associated with COVID-19? On this screen, I've outlined the guidance with regards to how you should manage those symptoms. Students and staff with symptoms of COVID-19 should stay at home until 24 hours have passed without fever and other symptoms have improved And this is where it gets a little complicated, they have a negative test or a doctor has provided evidence of another diagnosis or chronic condition, or 10 days have passed. So we have a few options on that last step to be able to clear and come back to school. Our office staff will remind families of these requirements as you are returning to school because it's a lot to keep in your head. Next, what about the work that my student will miss when they were out? This is one of the biggest concerns with families because missing work when children are out of school can be hard to make up and stressful on the home. I want to assure you that every student learning and belonging in our school is our top priority. When students are sick, our teachers will be providing work for them to do from home and support upon the students' return. We want our students to be healthy and well as they come to school. And on our end, we're going to help facilitate that by ensuring we have proper supports for students who may need to be out of school for several days. The next step of the multiple measures of mitigation are just really standard hand hygiene and sanitizing. Those good habits are really important to mitigating the spread of COVID 19. Our students will be reminded of the importance of good hand hygiene. Bathrooms will be fully stocked with materials for students for proper hand washing, and sanitation stations will remain in each classroom like they were last spring. In addition, our classrooms are going to continue to be cleaned daily by our custodial staff. Those high touch surfaces and student desks will be managed very carefully to make sure that they are cleaned every night. Additional cleaning supplies will be available in the classrooms. And if there's any known case of COVID 19, that classroom will be cleaned and disinfected before students return. Next, I want to talk about ventilation and maximizing airflow because this is a really important measure for keeping our classrooms safe. Our energy efficient project that we just completed at our school sites included new HVAC units for all of our schools equipped with CO2 detectors. This is great updated technology. Our previous HVAC systems were still really, really great. These just give us an additional measure to be able to ensure that we're managing the airflow and the air quality in that classroom space. Additionally, teachers may open windows and doors as appropriate given the heat and the air quality to increase airflow. They're also going to be utilizing HEPA filters provided in each classroom and fans that are also included in each classroom to keep the air really circulating and moving around. So, a big question that unfortunately we have to address here is what will happen on days with poor air quality. And the good news is our updated HVAC units maintain really healthy airflow. And during days with poor air quality, we do have the ability to close dampers on our HVAC units and control the indoor air quality at a higher level. That, in addition to the fans and the HEPA filters, is going to keep those classroom indoor spaces safe, even if our outdoor air quality is poor. Next, we come to masks. And this quote here, included on the California Department of Public Health K-12 guidance, really captures it all. Masks are one of the most effective and simplest safety mitigation layers to prevent in-school transmission of COVID-19 infections and to support full-time in-person instruction in K-12 schools. Universal masking in K-12 schools is recommended by the American Academy of Pediatrics and by the CDC in their guidance for COVID-19 prevention in K-12 schools. That was just recently updated at the end of last month, and this will remain our major way of mitigating spread of COVID-19. So let's talk about masks. I think we're all pretty familiar on the basics now, but just to paint a picture for you, all students and adults are required to wear masks indoors at all times on our school campuses, regardless of vaccination status. There are persons exempted from wearing a face covering due to a medical condition, and they must wear a non-restrictive alternative, such as a face shield with a drape on the bottom edge, as long as their condition permits it. If you have any of these conditions or your child does, please contact us and we'll help you navigate this language to have the right equipment when you come to school. Face coverings right now are optional outdoors in all TK-12 settings, and that is new from the spring, but that is the most updated guidance that we have right now. In the event that that guidance changes, we will also adapt our own rules and regulations in our school. Face coverings will, of course, be provided to students who inadvertently fail to bring a mask covering to school, so we don't have any unnecessary exclusions. So, a few questions that are coming up. Do vaccinated individuals need to wear masks indoors? Yes. The updated guidance from CDC and CDPH and the recommendations from the American Academy of Pediatrics states that all individuals must mask indoors. With universal masking, will students still need to physically distance? No, this is actually great news for our instructional strategies. Evidence suggests that when other mitigation strategies are used, like universal masking, it is not necessary to physically distance within the classroom space. We will still use our brand new single desk furniture that we purchased last year, which will allow our teachers to move desks apart as they need to make the classroom feel safe and comfortable, but we will no longer have to mandate that our students remain physically distanced at all times. While students are outside, what will the protocols be? Students will not need to wear a mask while outdoors per the CDPH guidelines. However, during lunch, sites will encourage distancing through multiple lunch locations and additional supervision. That's just an extra precaution to make sure that our students feel really comfortable as they're eating lunch around campus. Of course, students may always choose to wear masks while outdoors. So let's talk about quarantine and close contacts. This is another area that changed with the updated guidance. It makes the quarantine restrictions a little bit less than what we were seeing in the spring, with the intention of ensuring that kids can come back to school as quickly as possible and keeping students safe from potential close contacts. So it's able to thread the needle between these two areas to make sure that we're doing both of those things, keeping kids in school and keeping them safe. Quarantining may be required for close contacts who are exposed to an individual with a COVID-19 diagnosis. A person is considered a close contact if they are within 6 feet for more than 15 minutes over a 24-hour period indoors. Let me clarify. What that means is a student will be considered a close contact if they are in a classroom with another student, if they're in that same class with the student who tested positive for COVID. In the event that that happens, you will receive a notification from us letting you know that your child has been a close contact and with information outlining what your next step should be. The quarantine requirements differ depending on whether the exposed individual is vaccinated or unvaccinated. That's a different update from what we had in the spring as well. So I'm going to go through a few of these things around quarantine. If I lose you a little, do not worry. We will be prepared to help people navigate these requirements in the event that they need to quarantine. So the first thing to know is that with masks all the time indoors, we can undergo modified quarantines. Now, vaccinated individuals will follow the CDPH fully vaccinated people guidance. And here it's pretty simple. If you're a vaccinated individual and you are wearing masks indoors at all times in school and you test positive for COVID but have no symptoms, you will not need to quarantine. You will need to continue to wear your mask and you will need to continue to monitor your condition, but you will not need to quarantine outside of the class. If you do have symptoms, if anyone has symptoms, they must stay home and they must undergo testing. Unvaccinated individuals who have been wearing masks indoors, so this would really refer to most of our children, well, all of our children in the elementary schools, and most of our children who are in the middle school who may not be eligible yet for a vaccination. If they're exposed, they may continue to attend school if they are asymptomatic, they have no symptoms, they continue to wear their mask appropriately and as required, and they undergo at least twice weekly testing during the next 10 days to monitor whether or not they are positive for COVID-19. and they quarantine from all other extracurriculars, athletics, and other activities outside of the school day. But as long as they're asymptomatic and wearing their mask and being tested, they can still stay within the classroom space. This is a really long slide. So I'm not going to go through all of the pieces, but I will post this up and so folks can take a look at it at their own leisure. This slide really discusses what would happen very specifically for unvaccinated close contacts who were not wearing masks. The reason that I'm not going to go over this in a lot of detail is that it is not our expectation that there is ever a situation in our schools where there is an unvaccinated close contact indoors that was unmasked. Masks will be required indoors at all times. So, a few questions. Will I be able to get tested at a school site? Yes, we are going to offer weekly testing in Moraga. I will be sending you information about the timing and location and process for that. We are also partnering with our other districts nearby to ensure that we are offering test sites between our districts every day at one of our sites so that any day you could find a nearby testing site to get tested. Will the schools be doing contact tracing? Yes. If there's a positive case, school staff will work with Contra Costa Health Services to investigate and contact trace. Close contacts of a positive case will be notified by the school. Will the schools be doing surveillance testing? This has been in the news a bit. You may have read some articles about schools that are testing all students prior to coming back. At this point, the CDPH does not require or recommend that we do surveillance testing unless we have an outbreak at our school. We will not be testing all students before school begins, although that is always something that we would encourage families to do, just to have that extra data point and know what exactly your health condition is as you're beginning your school year. More details can be found on the CDPH testing strategies document that you can find attached here when I post this online and also online at the CDPH website. Next, we have vaccination, and MSD will follow the CDC vaccination verification recommendations for our employees. All employees are required to submit vaccine self-attesting verification to our Human Resources Department. Vaccination is an important factor in slowing community spread. Information about vaccines can be found on the Contra Costa Health Services vaccination page. And if you need any help navigating that, please reach out and we would be happy to help you. And that brings me to the end of the long CDPH document, but a few other norms to go over before I close up for today. Starting with visitors and volunteers. In order to minimize crowds and exposure on campus, visitors will be limited. And the visitors who do come onto campus must sign in at the main office and must wear a mask at all times, indoor and out. Parents will be permitted to bring young children, those TK and K, to their classrooms during the first 2 weeks of school as they get adapted to coming onto campus. But our volunteers will be limited to our yard duty and lunch supervision and food distribution so that we're keeping the crowds at a minimum. We will still be having in-person back to school night. At this time, field trips will not be happening, but we're going to continue to very closely monitor guidelines and conditions, and we'll revisit that throughout the year, hoping that things continue to improve and that we're able to get some field trips happening before the end of the year. And in food service, that will continue to be provided by the PTAs at our school sites. Thank you, parents. In order to maintain safety and food distribution, volunteers will be required to be vaccinated, surfaces will be washed, rinsed, and sanitized, and students will be distanced as much as possible while eating lunch. And so that concludes my very long summary of the COVID guidelines. And I just want to leave you with our commitment to you today. All students will learn and belong every day in Moraga. We're so excited for this school year to start. So I'll see you soon.